When I was younger, I was very sensitive. I could feel the pain that people endured. My father once told me, "It's good that I can feel people's pain. It would be even better if I could transform one's pain into soothing relief." These words of my father nourished and nurtured the divinely planted seed in me to become a compassionate healer, and my journey with Ayurveda, the science of life, began. According to Ayurveda, our Panchabhautik body is an amalgam of space, air, fire, water, and earth, and solution to all chronic ailments lies in balancing these body elements. As the origin of Ayurveda goes back to thousands of years, so some part of our ancient historical knowledge is lost. That's why I started my own research and shared it with the world. Ayurveda can give very quick recovery, even quicker than allopathy, in most chronic ailments.
The blend of Ayurvedic medicines, Panchkarma, yoga, diet has helped Dr. Nadeep Sharma create the brand Risht Pusht and Team Nirogam by treating thousands of patients suffering from chronic illness. Join Dr. Nadeep Sharma's guided path of healthy living. Call now at +1 888 624 5925.
A very good afternoon to all of you in this live interactive session of ours on autism. A warm welcome to all of you, and today being World Autism Awareness Day, it became very important for me to go live and be with all of you, because I can very well understand that when the world says that a person cannot come out of autism, believing that yes, a child can come out of autism at times becomes tough for us. So Gulshan Kumar ji, as you were asking, and we just had one of our friends from Pakistan asking, and people around the globe, the first major question which comes in the mind of a parent is, can my child defeat autism and come out of it? My answer is yes, that is pretty possible, and the first major bold step towards defeating the autism is believing. When everyone in the world is saying that autism cannot be defeated, a child with autism will remain like that throughout the life, and once the parents they start believing it, then it becomes difficult. But believe me, today on World Autism Awareness Day, when the first major thing which is important for the parents to realize is acceptance. When people approach us for their child, for their kids, Faisal ji, I'll be coming back to the same about hyperactivity and all. Keep me posted. I will request my team to keep me posted about his questions. Once I carry on with the normal discussion, I'll be then coming to question. You can all keep on posting your questions. Your questions are pretty important for us. But then, as I was just saying, the first bold step towards autism, towards its cure, is acceptance. And today on World Autism Awareness Day, it becomes very important for the parents to understand that if your child is not having a proper eye contact, if your child is not responding, if your child is not verbal, if your child is hyperactive, he may be suffering from autism. Now, it is very important for you being parents, first of all, to accept that there is some problem with the child. So what exactly is autism? What is autism? Let us come first of all to what exactly is autism. So in the slide which you can see over here, you can see what exactly is autism. It is a disorder which is a broad term used to describe a group of neurodevelopmental disorders. When we go with autism, there are so many things. We can remove the slide now. So there are too many things which are covered in autism. It is a broad spectrum disease. Even if we talk about ADHD today, that is attention deficit hyperactivity disorder, that once again is a part of autism itself. So what are the major signs and symptoms of autism? I would request team to please keep on numbering the queries, the questions which we are receiving, and all of you who are there with us, please be there Very soon I'll be coming to the questions, but first of all, the major signs and symptoms of autism. Majority of these signs and symptoms are available when you Google it up, and any parent whose child is autistic, many a times will experience the signs and symptoms. For example, a major thing which parents will tell us is no eye contact or less eye contact. Emotions are missing in autistic kids. The autistic kids many a times are hyperactive. When we are talking about all these signs and symptoms, your child may be having all of these, your child may be having some of these. But what is very important for you to realize is that, when we are talking about autism, the acceptance is something which is the most important. When parents, they approach us with their children from an age of 1.5 to 2.5, 3.5, now that is the best age for a child where he can come out of autism. But unluckily, at that age, the parents are not ready to accept. The grandparents are often heard saying to the parents, don't worry, तुम भी लेट ही बोले थे, तुमने भी लेट बोलना शुरू किया था, तुम्हें भी समय लग गया था, तुम भी आई कांटेक्ट नहीं करते थे. Unluckily, although the grandparents are just trying to give comfort to their child, to the children, they do not want anyone to be tagged as autistic child, and we also don't want any tagging of the child. But then it becomes very important that at the right age we can accept that yes, the child is having a problem, and if it is autism, that young age, that tender age, which is a reflex learning age for the child, that age of 2.5, that age of 1.5, that age of 3.5, that is really a very important age, and we should never miss out giving and choosing the treatment for the child at that age, because at that age, if we can work on the subconscious mind of the child, the things are pretty easier for us. What exactly causes autism is another major question which comes in the mind of parents. So parents come to me around the globe, they have one major question: why is my child autistic? You can see a lot of common reasons which are mentioned over here. It can be genetic reasons, there can be problems in MRI, it can be delayed crying. But remove this slide, because when people ask me, in 90% of the children there is no such reason. The brain is perfectly alright, and it is a disease of the mind where the conscious and the subconscious are not interacting with each other in a proper way. So next slide please. You can see that when we talk about autism, there can be various types of autism, as you can see over here, and this is my own distinction: Vataj autism, Pittaj of autism, Kaphaj autism, and then a Sannipataj autism. When we talk about Vataj autistic child, the child will be running here and there, he would not be sitting, he would be using his conscious mind to a great extent with less subconscious involvement. But even in that hyperactivity, the child will not be destructive. Whereas in Pittaj autism, with many of the symptoms as Vataj autism only, the child is having a destructive hyperactivity. Many of the children who are suffering from ADHD also come in the Pittaj autism category. And when we talk about Kaphaj autism, it is the opposite of Vataj and Pittaj autism, where the child will keep on sitting on one side, he will not be involved, the conscious mind will be used to quite lesser an extent. And in Sannipataj autism, all these signs and symptoms are merged together, and it is a tougher one to come out of as compared to other autism. The next, you can remove the slide now. And now coming to some of your questions. Before I proceed with my next slides, my next details, let us have some of your questions. So team, can you post once again the question number 1 which we had over here? I would also try going through the questions, and if someone you can post the questions for me, like Faisalji, you have mentioned over here about the products which you are using, the BrainOR which you are using, and you have mentioned that you are corresponding with Dr. Aarti from our center for all your treatments, and you have mentioned that you started the treatment 20 days back, and you feel that the hyperactivity and stomach issues are there. So anyone who starts with our Ayurvedic treatment, now this is a common thing which I want to reply to anyone. See, when we talk about Ayurveda, when we are giving any kind of treatment with ND care or anywhere else in Ayurveda, when we take a herb, that herb first of all will go inside the body, and our Jatragni, our digestive power, will digest that herb. Because herbs are nothing but food. They are not like the allopathic chemicals which will immediately go inside the body, will be attached to plasma proteins and will start giving some results. So when we are giving anything to a child, the herb will firstly go inside the body. The herb will now get digested. After the digestion, the herb will get absorbed. After absorption, the herb will bind with the plasma proteins, and then a plasma protein level will be maintained, and it will be after that that certain changes will start occurring in the behavior. And all this thing requires around 1.5 months to 2.5 months of time, and that is why I always give treatment to my patients in a phase of 6 months. I give six months of treatment to my patients, where on one hand we use the herbs which start showing some signs in the child, positive or negative. Generally it is positive, but in case any negative sign someone has experienced, it cannot be before using that herb for at least 2 to 2.5 months. And on the other hand, it becomes very important. Now, Faisalji, another thing which is very important which people miss out on is that, see, when we are giving any herb to the child, now the subconscious mind will start responding in a better way. The subconscious mind is a mind which controls the hyperactivity of the child. But then, what is very important over here for us to realize is that if we are using any kind of Ayurvedic supplement, any kind of Ayurvedic medication, wait for around 1.5 months, regularly give it, and then start observing the changes. And correspondingly, applied behavior application. All those of you who are believing on us for our treatments need to understand that for us, when we are giving treatment to the children, we are using Ayurveda and psychotherapy combined. We are not just using Ayurveda. Many of the patients who approach us will start the Ayurvedic treatment from us, but unluckily they forget that they have to go for a weekly session for applied behavior application through our psychotherapists. Now that is something which is very important. Let me first of all explain you the conscious and subconscious mind. See, you can see in this slide also, we are having a conscious mind and we are having a subconscious mind. When we talk about the conscious mind is the perceiving mind for our body. It is a channel through which anything can come inside, but things cannot go out through the conscious mind. Anything which we are to learn has to pass to the conscious mind and then gain access to the subconscious mind. All kind of learning, all kind of perceptions, all kind of questions which are being asked from us enter through the conscious mind, and then they are moved to the subconscious mind. Now the subconscious mind is the most powerful mind. It is having the power to gain something. It is having the power to reply something up. In autistic children, the subconscious mind becomes rigid. When we say rigid, it means that it will let all the information come inside, but will not let the information go outside on the demands of the conscious mind. So that is why in autistic children, even where the subconscious mind is perfectly alright, but since it is rigid, there will be some scenarios where the parents will feel that yes, my child is perfectly alright, he is replying to everything. There are junctures, but on other major junctures, the parent will feel that no, the child is not replying in a proper way. Because the dharnatmak buddhi, the subconscious mind is said to be the dharnatmak buddhi. That dharnatmak buddhi, if that is not responding regularly, there is where the problem lies. And that is why we use brain-OR. When we use brain-OR, that brain-OR which we are using empowers the subconscious mind, activates the subconscious mind, and then the subconscious mind starts responding on the demands of the conscious mind. But now lies the second major phase of treatment. Now the subconscious mind is ready to reply back, to respond back. But the conscious mind needs to ask those questions, only then the subconscious mind will respond. So on one hand, where we are empowering the subconscious mind and we are ensuring that yes, When the conscious mind is asking for words, the subconscious mind can reply back with words. But if still the parents keep on understanding the sign language of the child. Now, if the child wants a biscuit and the child holds the finger of the parents and the child takes the parents to where the biscuit is lying and the child gets the biscuit like that, why in this world will the subconscious mind reply back with those words? It won't. So that is why it becomes very important that on one hand, where we are empowering, we are making sure that the subconscious is working in a perfect way with the help of those supplements which we are using, which are there in Breno A, Breno R. Depending upon the need, we are using those supplements. I will just share a slide of you with you so that you know these are the major ones which we use. We use Breno A, we use Breno R in the form of syrups, in the form of capsules. Some of you who are staying abroad, we use dry syrups for them. We send them with dry syrups. So these are some of the major ones which we are using. You can remove this slide. I'll be coming to the contents of these also, why we are using it. But on the other hand, ABA is equally important, because if the child understands that he will not get a biscuit merely by pointing at it, it's then that the child will start speaking it out. And there are techniques on how to do that, which generally my teams of psychotherapists keep on guiding you. So it becomes very important. I always say the best psychotherapist for a child are the parents. If you want children out of autism and you have shown faith on us and you are taking our supplements, please do show faith on our therapies also. We require approximately 1 hour of your day where you are interacting with your child, and a 30 minutes of your week once with our psychotherapist, where we can plan the things on how you need to be interacting with your child. So I'll once again be coming to your questions and then I'll be moving ahead with my session. So the next question, team, if you can share with me the second question. And Faisal ji, I hope that answers your question, that immediately when you are taking anything from us, keep on giving the same stuff, keep on giving the same herbs for around 1.5 and 2 months, and then you will start experiencing on how they are working and what exactly they are giving, the changes they are making for you. ध्यान सिंह जी, आई कैन सी दैट यू मेंशन मेरे बेटे ने 3 मंथ से मेडिसिन लिया है आपसे, बट अभी तक सुधार नहीं हुआ है, कितना टाइम लगेगा? ध्यान जी, मैं आपको जो भी बता रहा था, मेरा रिक्वेस्ट वही रहेगा. देखिए, 3 महीने अगर आपके बेटे ने दवाइयाँ खाई हैं तो मैं उसके साथ साथ आपसे ये गुजारिश करूँगा कि आप प्लीज़ हर हफ्ते में आधा घंटा साइकोथेरेपी ज़रूर करवाएं. आपके पास हमारे हेल्पलाइन नंबर्स आ रहे हैं नीचे, इमीडिएटली इस पर कॉन्टैक्ट कीजिए. और आप जो 7 डेज अ वीक साइको कर रहे हैं फैसल जी, वो 7 डेज अ वीक आप कर, ये ध्यान जी की बात कर रहा हूँ. फैसल जी, आप जो 7 डेज अ वीक साइकोथेरेपी कर रहे हैं, वो आप साइकोथेरेपी कर रहे हैं, यू आर यूजिंग दैट साइकोथेरेपी विद द साइकोथेरेपिस्ट, वेयर द साइकोथेरेपिस्ट इज गाइडिंग योर चाइल्ड ऑन व्हाट टू डू. द सेशंस आर बीइंग डन. What is important over here is you as parents, what exactly you are doing. That is something which is most important for you, because what happens is a child, when he is going to a psychotherapist or any special educationist, the child is being trained in a special environment. For occupational therapy, for a speech therapy, that environment is not bad. But if we really want the children to come out of autism, what is most important over there is that those sessions are done by you. The child is to stay with you for such a long time, throughout the day, entire day. It becomes very important that when we are doing those stuff, when we are behaving with our child, I will quote an example for you, and I'll quote this example for all of you. For example, a child wants a biscuit and he sees a biscuit. The biscuit is out of his reach. The child holds the finger of mother and takes the mother to the place where the biscuit is there, and the child is given the biscuit. Immediately the behavior that a biscuit can be had without speaking, merely with the sign language, will be reinforced. Now when I say that, what the parents start telling me is, and what the parents they will start doing is, the mother says, "Pehle bolo biscuit, speak out its biscuit, John say biscuit." They will guide the child to speak out that yes, it is a biscuit. Now that is directing a child. That is a punishment approach. That is not going to help that much. If we talk about positive reinforcement, then what needs to be done is that on one hand, there will be a biscuit where the parent will take the child, and if the mother is the one to whom the child is demanding biscuit, immediately the father will enter over there and the father will say, give me biscuit. Mujhe biscuit do, give me biscuit. Now, what is very important over there to realize is that at that demand of the father, where the father is verbal, the father is to be given the same biscuit which the child is asking for, and the father now is to eat the biscuit and tease the child. Biscuit is very tasty, so that the child realizes that when we speak out something, we get the things. This is an example of positive reinforcement. That there are so many things in a positive reinforcement which need to be done. That is why planning those positive reinforcement sessions with our team is really very important. I'll be coming to your questions now quickly because I do not want to miss out on your questions, and I'll once again request the team to please keep on posting the questions for me so that I do not miss out on the questions. And I'll be going back. If I can, I'll try. There were questions which were posted my way. Right now, इंदु जी मैं आपका क्वेश्चन देख पा रहा हूँ, और इंदु जी से पहले आप प्लीज़ मेरे साथ बने रहें. मेरी कोशिश यही है, प्रयास यही है. आप में से किसी का भी क्वेश्चन मैं चाहूँगा कि मिस नहीं हो. मैं क्वेश्चन नंबर 3 की तरफ जा रहा हूं. और ध्यान सिंह जी, जैसा कि आपने जानना चाहा मुझसे कि आपको ट्रीटमेंट क्या देना है, तो मैं आप सबको ये बताना चाहूँगा कि जब कभी भी मैं इलाज करता हूँ, मेरा इलाज हमेशा 6 महीने के फेजेस में होता है. आप में से वो लोग जिन लोगों ने मुझसे वीडियो कॉन्फ्रेंसिंग करके, गुलशन जी आपकी चीज़ बता रहा हूँ कि आपने बताया गुलशन जी सर ऑटिज़म इज़ क्योरेबल और नॉट. जैसा कि मैंने आपको भी बताया, इट इज़ क्योरेबल. टाइम चाहिए पेरेंट्स का. अरुण विलोक जी, आपने वेट लॉस के लिए डिटेल्स जाननी चाहिए आपको. अगर आप अपना नंबर या डिटेल्स हमारे साथ शेयर करते हैं, पूरी डिटेल्स शेयर करवाऊंगा, लेकिन अभी समय कम होने के कारण खुद जवाब नहीं दे पाऊंगा. बहुत सी चीज़ें आयुर्वेद में आपकी मदद कर सकती हैं. BTS आर्मी जी, आपने बताया है काइंडली सुजेस्ट हाउ टू कम विद हेयर लॉस. आपसे भी मेरी रिक्वेस्ट रहेगी, प्लीज़ अपना नंबर हमारे हेल्पलाइन नंबर पे, जो नंबर आप देख रहे हैं, शेयर कीजिए. टीम आपको पूरा जवाब देगी इस बारे में क्या इस्तेमाल किया जा सकता है आयुर्वेद में फॉर हेयर लॉस. शिफान खान जी, आपने लिखा है वी हैव स्टार्टेड मेडिकेशन 3 months बिफोर एट रिस्ट पुश बट देयर इज नो इंप्रूवमेंट इन माय सन. प्लीज शेयर द, या शिफान जी प्लीज शेयर द पेशेंट कोड. दैट इज वेरी इंपॉर्टेंट फॉर अस. एंड एज आई वाज जस्ट मेंशनिंग, always compare the recovery in a phase of 6 months. And do remember, when you are taking treatment, if it is possible for you, if I am there in India, always prefer meeting. What I can observe when you are sitting in front of me is the best. What I can observe in a video conferencing is the second best. And if you are having no choice, do start the treatment after taking consultation from my doctors. Avoid going for treatment directly. What happens is, parents, they start with treatments online. Or someone tells them that my child really improved by taking Breno A, or someone says Breno R, someone says pumpkin oil. There are many things to be used in autism, and that is where a planning needs to be done. Each child is different. Again, the body type of each child is different. The conscious subconscious usage ratio of each child is different. So the treatment plan for each and every child is different. Please do not keep on following the same kind of supplements which you are taking. If you have met me, then yes, you definitely need to use the same for 6 months. If you have not met me, if you have not met any of my doctors, when I am in India, always prefer, if you are in India, to meet me, or those in UK, those in US, those in Canada, since those in UAE, since I regularly visit over there after a particular interval, you can meet me over there, because what can be observed physically with the physical presence of the child is really something different. And the second best, as I just said, is sending the videos. So prefer those things. So those of you who have been taking treatments and taking treatments without speaking to any of our doctors, my genuine request to you, please do speak to one of our doctors. So coming to the next question. I'll again be coming to the questions, and be there with me. I'll definitely try that none of the questions is missed. Achla Jain ji आपने लिखा है कि sir, I find difficult to do activities with my son as his school timings are from 8 a.m. to 2:30 p.m. Please, again Achla ji, I would request you to be sharing your patient code or details on the number. See, we only require your 1 hour with your child in a proper way. A 1 hour given by a parent to the child is really going to help the child, but you are to spare that time. We can understand that the child is going to school for a long time, but still, even if you are working 1 hour a day with your child in a proper way, that is really going to help. So please don't forget to do those activities which you are being guided. They are a part of treatment, and they are an equally important part of treatment, as important as taking those supplements. Nanda ji, thyroid के केस में, if you are asking about thyroid, please share your details, the TSH, T3, T4 levels, and you can share the reports on the number which is there on your screen. We immediately will be guiding you with certain things. Chatur Beej, Yavani, Chandrashur, Methi and Mangaral, they are really very good for a thyroid patient. But having said that, please share the report so that my team can guide you in a proper way. Soma Devnath जी, आपने लिखा है मेरा बेटा 6 years 8 month का हो गया है, उसको थ्रोइंग पुशिंग अभी तक नहीं ठीक नहीं हुआ है, उसको औषध 2 month से चल रहा है. प्लीज़ सोमा जी, पेशेंट कोड डिटेल्स और कुछ वीडियोस आप अपने बेटे के शेयर कीजिए हमारे इन हेल्पलाइन नंबर्स के ऊपर. और अगर अब तक आप मुझे नहीं मिले हैं, मेरी रिक्वेस्ट आपसे रहेगी कि प्लीज़ जब भी संभव हो, जब मैं यहाँ पर हूँ, मिलिए ज़रूर. आप में से वो लोग जो अभी फिज़िकली नहीं मिल पाए हैं, मेरी गुजारिश रहेगी जब भी इंडिया में हूँ, जैसे हमारा फाउंडेशन डे पास आ रहा है, उस फाउंडेशन डे पर भी हमारी एक स्पेशल ओपीडी रहेगी. आप अपने हेल्पलाइन नंबर्स पे हमारे अप्रोच कर सकते हैं, सो दैट वी कैन ऑब्जर्व योर चाइल्ड. दैट विल रियली बी अ वेरी इंपॉर्टेंट थिंग फॉर अस, एंड दैट इज़ रियली गोइंग टू हेल्प अस आउट अ लॉट. हम आगे चलते हैं आपके अगले क्वेश्चन की तरफ. एंड एनीवन हु फील्स दैट द क्वेश्चन इज नॉट बीइंग आंसर्ड, प्लीज कीप ऑन पोस्टिंग योर क्वेश्चंस. अगेन वी विल मेक श्योर दैट वी आर नॉट मिसिंग आउट ऑन एनी ऑफ योर क्वेश्चंस, एंड टीम प्लीज कीप ऑन नंबरिंग दोज क्वेश्चंस, ताकि हमारे से कोई भी क्वेश्चन, कोई इंपॉर्टेंट, क्योंकि 6th नंबर के बाद I have been able to reply to 13. So 7, 8, 9, 10, 11 ये क्वेश्चंस आप जरूर शेयर कीजिए. नंद झा जी, आपने लिखा है सर इस थायराइड क्योरेबल. तो नंद जी, मैंने आपसे रिक्वेस्ट किया जैसा कि आप प्लीज़ वो डिटेल्स शेयर कीजिए. रोशन जी, आपने कहा सर ऑटिज्म चाइल्ड इज़ नॉट वर्किंग इन होम एज you advice of your therapist. Roshan ji, what I would like to guide you is that, see, any of our therapists who will be working with you, who will be guiding you, will be guiding you with certain techniques which you are to yourself do for your child. For example, how the child is to be dealt with by you. For example, if the child is hyperactive, I'll just quote an example to you. Many of you generally tell that the child is very hyperactive. Now, a very easy thing for controlling the hyperactivity of the child is tiring the child in a positive activity. It can be having you can say something to jump on in one corner of the room where the child can go on a bouncy, and the child can keep on jumping, and the child can gradually tire up and use the excess energy, and then the child will become settled. There are many activities which can be planned. Faisal ji, you can meet me in UAE, brother. You can try when I am over there in UAE. You definitely can meet over there. You will get a visa easily for there, so we can meet over there. And majority of the patients who are from Gulf countries, who are from Pakistan, they meet me in UAE. You can meet me in UAE. There you will not face any visa restriction issues. And coming further to the next question, which I can see, Sandeep ji, you written, sir, you told that EEG test for the Arna case. When will I do the same? Sandeep ji, generally whenever the treatment which I have given is taken for around 6 months. So within those 6 months, before meeting me the next, you need to get an EEG done. And Rupinder ji written, sir, my son is 3 years old and taken your medicine last 4 months. All our improvement is good, but he smells the food but not takes it all kind of food. Rupinder ji, do not worry. you need to update and bring this issue in the my knowledge of my team when they are over there. Nasya kriya, we will be doing nasya kriya for your child, and you will see a very good improvement in the child due to this. Nasya is to be done. Please share your patient code and or please share your question on the helpline number so that my team can reply you back in this regards over there. मिथिलेश जी आपने लिखा है मेरा बच्चा कब स्कूल जाएगा सर, प्लीज़ हेल्प मी। मिथिलेश जी, मैं जनरली सभी ऑटिस्टिक पेरेंट्स को ये बताया करता हूँ कि अगर आपका बच्चा बहुत हाइपर एक्टिव नहीं है उसे नॉर्मल स्कूल भेजिए, अगर आपका बच्चा मॉडरेट से सीवियर ऑटिज्म में उसे स्पेशल स्कूल भेजिए, स्कूल अवश्य भेजिए। आप में से बहुत से पेरेंट्स के क्वेश्चन जनरली मैं समझ सकता हूँ आपके इमोशंस के कारण। हर बच्चा माँ बाप की ज़िंदगी होता है और एक माँ बाप अपने बच्चे का दुख नहीं देख पाते हैं, अपना दुख फिर भी सह पाते हैं। एज अ डॉक्टर, एज ए कंसल्टेंट, मैं हमेशा एक बात का प्रॉमिस करता हूँ अपने पेशेंट्स को कि देखिए हमारे एंड से आपको पूरे के पूरे एफर्ट्स ज़रूर मिलेंगे, और ज़रूरी क्या है कि आपके एंड से भी एफर्ट्स ज़रूर मिले। बहुत बार पेरेंट्स जो हर्बल सप्लीमेंट्स हम लोग देते हैं वो सब तो दे पाते हैं, लेकिन समय जो हमें चाहिए होता है वो समय उनकी तरफ से हमें उतना नहीं मिल पाता है। वर्क करना और प्रॉपर खर्चों को मीट करने के लिए वर्क करते रहना हर पेरेंट की एक नीड है, स्पेसिफिकली फॉर ऑल ऑफ दोज हु आर स्टेइंग अब्रॉड। It's even tougher because the parents really have to work and for the livelihood and home supports and all are less. But मेरी फिर भी गुजारिश यही है, एटलीस्ट 1 hour जो हम गाइड करें अगर आप उसके अकॉर्डिंग देते हैं, you will definitely see a good recovery. And there is another question which I can see over here. Before I go offline, I'll be going with that question also. मोहिता जी आपने लिखा है where there is social fear and anxiety in a child when child faces unknown interaction, this will get resolved with medicine or therapy. Mohita ji, both medicines and therapy. See, if we talk about social interaction, even for us, if someone asks many of us to go on a stage and start giving a talk or singing a song, it is tougher for someone like us also to sing on a stage than sing in a room. So new challenges facing the society is tough for all of us also. But इसके साथ साथ जो चीज़ें बहुत ज़रूरी हैं, द अनदर थिंग विच इज़ इम्पॉर्टेंट इज़ दैट इफ़ इट इज़ टफ फॉर अस, फॉर ऑटिस्टिक चाइल्ड इट इज़ इवन मोर टफर. सो दैट इज़ वाई ये बहुत ज़रूरी है दैट when we are giving treatment to the child with those herbs which can work on the subconscious, which can improve the subconscious mind's functioning, improving the social interaction, giving confidence to the child is something which also requires applied behavior application, and that applied behavior application has to be done through the parents. Jayashri ji, we will be starting the Ahmedabad Panchkarma Center this Baisakhi on the 13th of April. It will be a wrist pushed Panchkarma Center. When we say wrist pushed Panchkarma Center, that is different from ND Care Panchkarma Center, but yes, that is good enough for you to get certain therapies done over here there. So my team will be guiding you in that regards. Many of our centers are reopening this Baisakhi, which is also the foundation day of our center. So कुछ क्वेश्चंस मेरे पास हिंदी में गुलशन जी आपकी तरफ से भी आए हैं, जैसे कि आपने बताया है कि आप अपने बच्चे को लेकर मोहाली सेंटर आए थे और सब चीज़ें डिस्कस हुई। हमें 2 साल पहले पता लगा था कि उसको ऑटिज़म की प्रॉब्लम है। 2 साल से हम उसको थेरेपी, शायद आप लिखना चाहते हैं कि आप दिला रहे हैं, और उसको इम्प्रूवमेंट काफ़ी है। बहुत बढ़िया बात है गुलशन जी, आप सारी चीज़ें कैरी ऑन भी कीजिए। बाकी जैसे जैसे देखिए, मैं एक दूसरी चीज़ जो सभी पेरेंट्स को कहा करता हूँ, देखिए आज अगर आप आयुर्वेद नहीं भी अपनाते हैं और केवल ऑक्यूपेशनल थेरेपी, स्पीच थेरेपी, अप्लाइड बिहेवियर एप्लीकेशन जिसे बिहेवियर थेरेपी बोलते हैं, जो आप लोग अपने साइकोथेरेपिस्ट के सेंटर्स पे जाकर करवा रहे हैं, केवल मात्र वो भी करते रहते हैं, तब भी आप इम्प्रूवमेंट ज़रूर देखेंगे अपने बच्चे में। बट हमारे साथ आप क्यों जुड़ रहे हैं? क्योंकि हमें केवल इम्प्रूवमेंट नहीं चाहिए, हमें चाहिए है कि हमारा बच्चा ऑटिज़म को गुड बाय कह सके और हम एक टेम्पररी फेज की तरह जिंदगी में ऑटिज़म को देख पाएँ। सो आए आज इस वर्ल्ड ऑटिज़म अवेयरनेस डे पर हम एक दूसरे के साथ मिलें, जुड़ जाएं, आयुर्वेद और साइकोथेरेपी दोनों को आपस में मिला लें, ताकि इन नन्हे मुन्ने बच्चों को जो पूरी तरह से इस डिजीज़ से बाहर आ सकते हैं हम ला पाएँ। बहुत बार विश्वास करना मुश्किल हो जाता है, लेकिन मेरी आपसे रिक्वेस्ट यही है, अगर विश्वास की कहीं भी आपको कमी लगती है आप आएँ, हमारे सेंटर पर आकर मिलें और यकीन मानिए ये बच्चे ऑटिज़म से बाहर जा सकते हैं। आप में से कुछ लोगों के क्वेश्चंस का जवाब शायद मैं नहीं दे पाया होऊंगा, उसके लिए मैं माफ़ी चाहूँगा क्योंकि क्वेश्चंस अधिक हैं और समय कुछ कम है। लेकिन एवरी वीक एज आई जस्ट सेड आई गो लाइव with all of you, so all your questions are welcome for my next live sessions। आप ज़रूर जुड़ा कीजिए, आपके क्वेश्चंस बहुत महत्वपूर्ण हैं क्योंकि एक व्यक्ति के द्वारा पूछे गए क्वेश्चंस दूसरे व्यक्ति को जरूर लाभ पहुंचाते हैं। आए मिलकर इस वर्ल्ड ऑटिज्म डे पर यह प्रण उठाएं कि हम पूरे एफर्ट्स लगाएंगे इन प्यारे से बच्चों को ऑटिज्म से बाहर निकालने के लिए। हमारे साथ आज आप जुड़े इसके लिए बहुत बहुत धन्यवाद। नमस्कार।